So this patient had a neck injury, and today we're checking his range of motion to his left and right rotation. As you can see, he can turn farther to the left than he can to the right. He also feels more discomfort when he turns to the right. So we're going to get to work. So we start by having him lay face down, and we check his structural alignment. He's a little bit short on one side, which is his right side, so we block it with pelvic block. Recheck, he's equal. Now we go to work and we do some low back, lumbar mobilization, and we'll use the drop table to adjust his pelvis. Now we move on just to some deep percussion work using a Vibracussor. And again, just helps the low back stay relaxed and kind of prepare him before we get ready to use the drop table for the gravitational pattern alignment. Now here I'm just adjusting the table and the tension on the table to get the drop set. Here we go, we hit the drops, adjust, hit the drops, adjust, change positions, drop again. Remove the block, and then we come back out and we double check leg length, and he's good to go and he's lined up. Now I'm having him flip on over. We're gonna just do a quick fascial stretch therapy assessment, see how his range of motion to his hips gone. He's actually been doing pretty good, so we're just gonna do general maintenance and work through his lower body fascial stretch therapy. All right, now we're moving on to his upper neck and his trap area. We're doing some fascial release as well as some manual muscle technique therapy that's helping just release the upper trap, scalenes. Got my hand behind his shoulder blade, scapula, working through the scapular region. There you can see I'm poking through the front of the scalenes, a little bit of pec, major, minor action to help get that released. Now again, this was the injured side, so I'm spending a little more time working through the whole upper neck and just the scalenes again, shoulder area, before I move on to the left. So now we're basically doing the same thing on the left side, going through some fascial range of motion, manual muscle therapy, release techniques, and just kind of making sure he's in balance with his left side. Everything's been working well with his left, checking his neck, and we're moving on. Back to the right side, now I'm doing specific rotation work for the neck and manual muscle work, specifically on the deep rotators of the neck, and just trying to increase his range of motion because you can certainly feel he's locked up on still some of the deep muscles on the right side of the neck. Here we go. Now we got him sitting up, and we're just doing a little more seated neck and trap work as he's putting his head through range of motion actively. Now we're double checking his range of motion. He can certainly move farther to the right. He's feeling good. He's excited. And we're just going to finish up with a little bit of percussion work using that Vibracussor again, just to kind of help loosen up the fascia. Here we're finishing up. We're going to have him do one last range of motion check, see how he's feeling. He's feeling good. He's excited.